Asthma is a chronic respiratory disease that affects the airways in the lungs. These airways become inflamed and narrowed, making it difficult for air to move in and out. This can lead to a variety of symptoms that can range from mild to severe. It affects millions of people worldwide, regardless of age, gender, or ethnicity. Asthma does not discriminate, and its impact can be felt in both urban and rural settings. This condition inflames and narrows the airways in the lungs, making breathing difficult and triggering symptoms like wheezing, coughing, and shortness of breath. These symptoms can be triggered by various factors, including allergens, exercise, cold air, and even stress. Understanding asthma is crucial. It helps us manage the condition and minimize its impact on our lives. Asthma is often misunderstood, with many people thinking it's just about occasional breathlessness. However, it's a complex condition that requires ongoing management and a comprehensive treatment plan. It's not just about occasional breathlessness, it's a complex condition that requires ongoing management. Medications, such as inhalers, play a vital role in controlling asthma symptoms and preventing asthma attacks. These medications help to reduce inflammation and open up the airways, making it easier to breathe. Throughout this exploration, we will delve into the core aspects of this respiratory ailment. We will look at how asthma is diagnosed, including the use of lung function tests like spirometry, which measures how much air you can breathe in and out, and how quickly you can do so. We will explore its causes, diagnosis, and the range of treatments available. Asthma can be triggered by a variety of factors, including allergens, respiratory infections, and environmental pollutants. Understanding these triggers is key to managing the condition effectively. By understanding asthma, we empower ourselves to lead healthier lives and breathe a little easier. With the right knowledge and tools, individuals with asthma can manage their symptoms, reduce the frequency of asthma attacks, and enjoy a better quality of life. Regular exercise, a healthy diet, and avoiding known triggers can all contribute to better asthma management. Asthma is a multifaceted condition with a complex interplay of contributing factors. While the exact causes can vary from person to person, several key elements play a significant role in its development. One of the primary culprits is genetics. A family history of asthma increases an individual's likelihood of developing the condition. This suggests that certain genes can make individuals more susceptible to airway inflammation and hypersensitivity. These genes can be passed down from parents to their children, predisposing them to asthma. While genes lay the groundwork, environmental factors often act as triggers, setting off the cascade of inflammatory responses that characterize asthma. The genetic predisposition to asthma means that certain individuals are more likely to develop the condition if they are exposed to specific environmental triggers. This interplay between genetics and environment is crucial in understanding why some people develop asthma while others do not, even when exposed to similar conditions. Exposure to allergens is a common environmental trigger. These allergens can be found both indoors and outdoors, and they can vary greatly depending on the individual's surroundings. For instance, in a household setting, common allergens include dust mites, pet dander, and mold. These tiny particles can easily become airborne and inhaled, leading to an allergic reaction in sensitive individuals. These allergens can range from indoor irritants like dust mites, pet dander, and mold, to outdoor pollutants such as pollen and air pollution. Outdoor allergens such as pollen from trees, grasses, and weeds are seasonal and can vary in concentration depending on the time of year. Urban areas often have higher levels of air pollution, which can exacerbate asthma symptoms. The combination of these indoor and outdoor factors can create a challenging environment for individuals with asthma. When an individual with asthma inhales these allergens, their immune system overreacts, triggering airway inflammation, constricting the airways, and making it difficult to breathe. This inflammatory response is the body's way of trying to protect itself, but in the case of asthma, it can lead to severe breathing difficulties. The airways become swollen and produce excess mucus, further narrowing the passage and making it hard for air to flow in and out of the lungs. Respiratory infections, such as colds and the flu, can also exacerbate asthma symptoms. These infections can cause the airways to become even more inflamed and sensitive, leading to increased asthma attacks. It's important for individuals with asthma to manage their condition carefully during cold and flu season, as these infections can significantly worsen their symptoms. These infections can irritate the airways, making them more susceptible to inflammation and bronchospasm. leading to increased asthma symptoms. Bronchospasm is a sudden constriction of the muscles in the walls of the bronchioles, causing the airways to narrow. This can result in wheezing, coughing, and shortness of breath. Effective management of asthma involves avoiding known triggers, using medications as prescribed, and monitoring symptoms closely to prevent severe attacks. Diagnosing asthma involves a comprehensive evaluation of an individual's medical history, physical examination, and lung function tests. Doctors typically begin by taking a detailed medical history, inquiring about the patient's symptoms, family history of allergies or asthma, and any potential triggers. This information provides valuable clues about the nature and severity of the condition. A physical examination is also essential, allowing the doctor to assess the patient's overall health and look for any signs of respiratory distress. Section 5. Lung function tests. Measuring breath to understand asthma. Lung function tests are, crucial in diagnosing and monitoring asthma. These tests measure how well the lungs are working, providing objective data about lung capacity and airflow. One of the most common lung function tests is spirometry. During this test, the patient breathes into a mouthpiece connected to a machine called a spirometer, which measures the volume and speed of air inhaled and exhaled. Spirometry helps assess airway obstruction and determine the severity of asthma. By measuring lung function, doctors can make informed decisions about diagnosis, treatment, and management. Section 6. Treatment strategies for bronchial asthma. Treating asthma effectively involves a multifaceted approach that aims to reduce inflammation, open up the airways, and prevent future attacks. Bronchodilators are a cornerstone of asthma treatment. These medications work by relaxing the muscles surrounding the airways, allowing air to flow more easily. Bronchodilators provide quick relief from asthma symptoms and are often used as needed. Inhaled corticosteroids, on the other hand, target the underlying inflammation in the airways. Section 7. Navigating the labyrinth asthma medications explained. Inhaled corticosteroids work by reducing airway inflammation and swelling, making them effective for long-term asthma control. These medications are typically taken daily and help prevent asthma attacks by keeping the airways less sensitive to triggers. In addition to bronchodilators and inhaled corticosteroids, other medications may be used to manage asthma, such as leukotriene modifiers, which block the action of leukotrienes, inflammatory chemicals that contribute to asthma symptoms. Section 8. Living with asthma. Managing symptoms and reducing risks. Living with asthma can be challenging, but with the right strategies, you can lead a healthy and active life. Living with asthma requires proactive management to minimize symptoms and reduce the risk of complications. This involves working closely with your healthcare provider to develop a personalized asthma action plan. One of the most crucial aspects of asthma management is avoiding triggers. Triggers can vary from person to person, but common ones include allergens, smoke, and strong odors. Identifying and minimizing exposure to allergens and irritants that can exacerbate asthma is essential. This means being aware of what substances or environments cause your symptoms to worsen and taking steps to avoid them. This may involve making changes to the home environment, such as using dust mite covers on mattresses and pillows, and investing in a high-quality air purifier to keep indoor air clean. Keeping pets out of bedrooms, especially if you are allergic to pet dander, and controlling mold growth in damp areas like bathrooms and basements are also important steps. Regularly cleaning and vacuuming can also help reduce indoor allergens. Use a vacuum with a HEPA filter to trap dust and allergens more effectively. Outdoor triggers, such as pollen and air pollution, can also be problematic for individuals with asthma. Monitoring air quality reports and staying indoors on high pollen or high pollution days can help manage symptoms. Wearing a mask when outdoor air quality is poor can provide additional protection. Regular use of medications as prescribed by your doctor is another key component of managing asthma. This may include daily controller medications to reduce inflammation and quick relief inhalers for sudden symptoms. Regular follow-up appointments with your healthcare provider are essential to monitor your condition and make any necessary adjustments to your treatment plan. Open communication with your doctor about your symptoms and any changes you notice is crucial for effective asthma management. Incorporating healthy lifestyle habits, such as regular exercise and stress management techniques, can also help improve asthma control. Activities like yoga and breathing exercises can strengthen your respiratory system and reduce stress, which can be a trigger for some people. Finally, educating yourself about asthma and connecting with support groups can provide valuable information and emotional support. Understanding your condition and learning from others who share similar experiences can empower you to take control of your asthma and live a full, active life. Section 9. The importance of asthma control. Asthma is a chronic condition that requires ongoing management and attention. By understanding the causes, recognizing the symptoms, and seeking appropriate medical care, individuals with asthma can live full and active lives. Proper management, including medication adherence, trigger avoidance, and regular monitoring, is essential for keeping asthma under control and preventing complications. With the right knowledge and tools, individuals with asthma can breathe easier and live life to the fullest.